Okay, today we'll talk about the Philips Duo Venous Stent system. I do want to, no disclosures, I do want to mention that the Duo system is currently investigational use only and not FDA approved for clinical use. We'll talk about the genesis of what brought about this, the creation of the Duo Venous Stent system. So we've seen in a lot of cases earlier today in discussion that there's a lot of various needs along the iliofemoral and caval segments of the venous system that require different qualities of these stents that we need to keep patency open for the indefinite future. We see that in the May-Thurner region or at the bifurcation, we need a higher crush resistance. We need increased flexibility along the external and common femoral venous system, and we need a lot of durability along those multiple axis flexion points and extension points in the hip, along the inguinal ligament. We also, as we've talked about numerous times earlier today, we need to maintain and assess adequate inflow for these stents to be patent. Previous articles have shown the various segments of these venous systems require different properties of these stents to be open. And you can see here on these different positional CT scans that the flexion and extension of the hip mobility joint actually doesn't really, like Dr. Desai mentioned earlier, does not depend on extension and flexibility across the inguinal ligament. And actually, we can cross inguinal ligament fairly commonly without issue. The current challenges, which we've also noticed, is that a lot of these stents do end up having kinks or demonstrate gap formation or fish scaling throughout their longevity. And these are all kind of like the reasons why the Duo Venous Stent system was formed to address these issues. And we'll talk about the stent itself very quickly. So the first stent that the system includes is the Duo Hybrid Venous Stent. And it includes various geometries across the stent to assess and provide those adequate features along the segment of the iliocaval segments. As we can see here in the May-Thurner segment or at the bifurcation, this geometry of the stent imparts high crush resistance, and it gradually tapers with a decreasing stent structure to allow for increased flexibility and especially increased radial force in the inflow to reinforce inflow at the femoral region. The Duo Extend is partnered with the Duo Hybrid. It's supposed to be used in conjunction with the Duo Hybrid stent, and this is to extend the stent all the way down into the common femoral region. The overlap segment is given here to allow for a little bit more flexibility and an additional crush resistance. The portfolio, as you can see, is fairly typical as we have for the other dedicated venous stents. Includes stent diameters from 12 to 18, excuse me, and similar for the Duo Extend as well on both a 9 and a 10 French platform. This is currently being studied in the VIVID study. This was, I think, enrollment completed in December of 2021. This is a prospective, multi-center, single-armed, non-blinded study and compared to performance goals depending on the subsets. The intended use was for use in iliac and common femoral veins for improving the luminal diameter. For symptomatic venous outflow obstruction. The population, these are subjects with non-malignant iliofemoral venous outflow obstruction presenting with non-thrombotic, acute thrombotic, and chronic post-thrombotic disease. 160 subjects were enrolled in both the United States and Europe. Going over the key inclusion and exclusion criteria, it's fairly similar to the prior IDE studies, where we were looking at common femoral vein, external iliac vein, or common iliac vein reduction of a greater than 50% in reduction in diameter, symptomatic obstruction with at least one of the following with a SEEP score of greater than 3, a VCSS pain score greater than 2, or suspected DVTs. Also, we needed to have a successful treatment of acute thrombus if there was an acute thrombus event preceding stenting. Exclusion criteria included those following, where the target limb symptoms were either caused by PAD, there's significant presence of pulmonary emboli, presence of IVC or venous obstruction more centrally, or there was contralateral venous occlusive disease as well. The primary endpoints that were looked at were our primary safety endpoints of 30 days was freedom from major device-related procedure death, major bleeding or venous injury, major amputation or of the target limb, clinically significant PE, stent embolization, and presence of a new thrombus within the stented segment. Efficacy was looked at 12 months, defined as freedom from stenosis at duplex ultrasound, adjudicated by a core lab of greater than 50%, or clinically driven target lesion intervention. Secondary and observational endpoints were at 12 months for secondary efficacy, including subject relief via VCSS pain score, primary assisted patency, and secondary patency. Observational endpoints were looked at 24 and 36 months and through 36 months, including device, lesion, and procedure success, primary patency, primary assisted patency, secondary patency, and changes in VCSS pain score. Patient-reported outcomes were also assessed through 36 months. So basically, in summary, this is a current venous stent system that's currently being studied for investigational use. It includes both the Duo Hybrid and the Duo Extend stents, which gradually change their morphology and characteristics along the iliovenous segments, iliothermal segments, to allow for better patency of stenting for these patients with both acute and chronic thrombosis. Okay, thank you.